Welcome to Salivary Veterinary Care Centers. Today, we are performing a salivary gland removal to cure a salivary mucocele in an older dachshund. This pet has a large mass under its neck and chin, which contains a honey-like fluid, concentrated saliva that accumulates due to a blocked salivary duct. Saliva normally travels from the salivary glands to the mouth through ducts. However, in this case, the duct is blocked, causing saliva to accumulate in the neck tissues. Over time, excess water is absorbed, leaving behind a thick, honey-like exudate. These cysts were historically known as honey cysts. The patient is prepped for surgery by shaving the area over the salivary glands. We will be removing the mandibular and sublingual salivary glands. The parotid salivary gland, located just under the ear, will be exposed along with the mandibular gland, which lies beneath it. The sublingual salivary gland extends from inside the jaw forward toward the tongue. An incision is made over the parotid and mandibular salivary glands. The parotid gland is shovel-shaped, while the mandibular gland is round. The mandibular gland is elevated out of its capsule, and its duct is traced inside the jaw, under the tongue, for removal. This delicate surgery sometimes requires magnification to avoid damaging arteries and nerves that serve the tongue. Once the salivary glands are removed, the mucocele is opened, and a rubber drain is placed through the gland. As the cyst is opened, the thick, honey-like gel drains out, which can actually be picked up by the fingers. The drain is placed through the area where the gland was removed and through the cyst. This is crucial because the cyst creates an empty shell of tissue that can form a serum-filled bubble if not properly drained. The drain tube stays in place for 5 days, and a bandage is wrapped around the neck to catch the drainage fluid. The surgery site is then sutured closed. As the dog is taken off anesthesia and begins to awaken, there's always a concern for potential nerve damage. The facial nerve, glossopharyngeal nerve, and hypoglossal nerve could be affected. However, if these nerves are damaged, their function usually returns within a few weeks. In addition to the surgery, this dog is also being treated for a skin disease, likely a bacterial or staph infection. During surgery, the pet is on N4, which maintains kidney function and serves as a route for emergency drug administration if necessary. The technician deflates the cuff around the endotracheal tube, ensuring it fits snugly within the trachea, then moves the dog to the recovery area. The recovery area is shared with other animals, like a guinea pig in this case. The technician trims the pet's nails and continues post-operative care. An AMBU bag is used to assist the pet's breathing during recovery. The surgery technician will monitor the pet until it starts to wake up, then hand off care to another technician to prepare for the next surgery. The pet is gently patted and rubbed to stimulate waking and breathing. Thank you for joining us at Salivary Veterinary Care Centers. We are dedicated to providing the highest level of care and comfort for all our animal patients.